Hyperviscosity, Roulet, Retinopathy, Waldenström macroglobulinemia. Universidad Católica Santiago de Guayaquil, Neuroscore, Vicente Paul. Datos personales, Manay, Marixorama, My Teacher, John Moscoso. Definition: Waldenström macroglobulinemia, X and proliferative visual discord, characteristic big overproduction of monoclonal X. The most frequent diagnosis is patients with hyperviscosity syndrome caused by paratroteinemias.
Some remarkable things have happened in Waldenström's macroglobulinemia in the last 2 to 3 years that have truly changed the way we look at this disease. You know, it had been described for almost 70 years, and yet we didn't know what the genetic basis of the disease was. And this was really the reason why we couldn't move forward and develop novel therapies for patients with Waldenström's macroglobulinemia. So we had to rely on what's called hand-me-down therapies, you know, things that we waited for our colleagues in the lymphoma world, myeloma world, to be able to vet out and ultimately, you know, get our hands on these things. So 3 years ago, we reported the discovery of mutation in the MYD88 gene. This is, you know, was a pivotal moment for our field, since over 90% of the patients with Waldenström's actually express this mutation. And then subsequent work by us and others ultimately helped identify the important signaling pathway that's triggered by this mutation. Then came also the discovery of the CXCR4 mutation, which is present in about 1/3 of patients with Waldenström's, and this gave us further insight into the disease. And you know, the important outcome of these two discoveries has been the development of the drug ibrutinib. It was very quickly recognized by work that was done in our laboratory that MYD88 triggered, you know, Bruton's tyrosine kinase, BTK. And this is, of course, the target for ibrutinib. And in a short time frame, we were able to translate this into a clinical trial, which received breakthrough status by the FDA, and as you probably know, just recently received FDA approval for the use of ibrutinib in patients with Waldenström's. And this was based on that scientific discovery.
Waldenström's macroglobulinemia is a disease with two significant issues. In the bone marrow, or sometimes in the spleen and lymph nodes of patients, there is a lymphoplasmacytic lymphoma, or lymphoplasmacytic infiltrate. But there also is a second issue, and the second issue is a high serum level of IgM, a monoclonal protein of IgM antibody variety. And the issue related to the IgM is often what impacts patients substantially. This big protein causes the blood to be more viscous or thick compared to normal. That can cause a lot of sludging and lack of delivery of oxygen to various parts of the body, the fingertips, the brain, even the eyes, causing kind of organ dysfunction. Waldenstrom's macroglobulinemia is a disease with two significant issues. In the bone marrow, or sometimes in the spleen and lymph nodes of patients, there is a lymphoplasmacytic lymphoma, or lymphoplasmacytic infiltrate. But there also is a second issue, and the second issue is a high serum level of IgM, a monoclonal protein of IgM antibody variety. And the issue related to the IgM is often what impacts patients substantially. This big protein causes the blood to be more viscous or thick compared to normal. That can cause a lot of sludging and lack of delivery of oxygen to various parts of the body, the fingertips, the brain, even the eyes, causing kind of organ dysfunction.
Joined now by Dr. Alessandra Tedeschi. She's from Italy. Thank you for stopping by and spending some time with us.
Thank you.
Let's talk about this retrospective study for which you're presenting data.
Well, this is a study we conducted as in ESMO and CCN guidelines. Bendamustine is considered a suitable treatment for Waldenström macroglobulinemia, but there are not so many data in literature. There is only one study for frontline patients, and there were 21 patients treated with this combination, and another study from Professor Trion of Dana-Farber with just 28 patients enrolled. So we made this retrospective study to validate this combination treatment in Waldenström disease, and to see the toxic profile of the combination as salvage treatment.
So what did you find?
The schedule is very well tolerated. Patients with Waldenstrom are patients with an old age. The median of age of our patients enrolled was 72 years, so quite old population. And we found that is very well tolerated and at the same time is effective even in patients heavily pretreated with 2 or more lines of treatment. We gave a lower dosage of bendamustine in the older patients, the older population. We had 4 patients above 80 years old that received 50 milligrams of bendamustine, but the toxic profile was very good.
So this was really about validation.
Yes, a sort of, yes. There are most of Waldenstrom studies are enrolling a very small number. It's a rare disease, so the number of patients enrolled is normal in the studies is very low. And so we wanted to just to validate the schedule and the combination.
So as you finish this work, what do you think is most significant about what you've discovered?
That bendamustine is very well tolerated. The follow-up at this moment is very short, but as one of the biggest issue with this disease is the late toxicity of the combinations treatment. Purine analogs are very effective, but maybe there are a lot of late toxic effects like secondary leukemias or myelodysplastic syndrome transformations. And it seems that bendamustine doesn't give these late toxicities, so maybe we have to follow further our patients. Maybe this can be a next study of late toxicity of bendamustine in these patients, but till now we didn't find any important issue with this drug.
Thank you, Doctor. We appreciate you sharing your information
Thank you.
with us.
Thank you.
Conclusión. Retinal manifestación of hyperviscosity. Síndrome occurs at lovely serum in IgM level and previously reported indirect or ophthalmoscopy with cerebral depression with renal vessel diameter measurements are though detect the hyperviscosity syndrome renal complication and should be considered in the treatment of pain with
Waldenstrom's macroglobulinemia is in part named for the Swedish scientist Jan Gustav Waldenstrom, who identified the disease in the 1940s. The term macroglobulinemia comes from the characteristics of the protein molecule where the cancer is found. Waldenstrom's macroglobulinemia, WM for short, is a type of non-Hodgkin's lymphoma that involves the B-cell antibody known as immunoglobulin M, IgM. IgMs are the largest antibody protein molecule in the body and is consequently known as a macroglobulin. Waldenstrom's originates in the bone marrow and most typically affects the blood, but it is also found throughout the lymph system and therefore can affect various organs and lymph nodes. This disease is a slow-growing and rare cancer that typically affects older people, half of which are over the age of 60. With Waldenstrom's, some of the IgM molecules become cancerous and clone abnormally, Normal cell death is not programmed properly in these cells, and as they multiply, they clog the blood, making it thick. The thickening of the blood is known as hyperviscosity. Symptoms of the disease can include nosebleeds, night sweats, fatigue, dizziness, headaches, blurred vision, numbness in the extremities, or an enlarged liver, spleen, or lymph nodes. Until the 1990s, little was known about the disease, and there was little progress in treatment options. But from the 1990s on, rapid advances in medical science have greatly changed what we know about the disease, as well as treatment options that have dramatically improved patient outcomes.